I want to welcome Dr. Zachariah. This is our second installment of Ask the Expert series. We are coming to you via live stream at crpc.tv, and so excited for this next installment where we're going to be talking to a leading expert in the healthcare community. He is Dr. Zachariah. He is a cardiologist with the University of Miami School of Medicine. He is the chairman of the medical board for the state of Florida. Also regularly sees patients at Holy Cross Hospital and Imperial Point hospitals here in Broward County. Most importantly, he is a long-standing faithful member of the Coral Ridge Presbyterian Church. The Zachariah family has been a part of the Coral Ridge community for so many years. He is one of the leading physicians, not only in our region or the state of Florida, but in North America. And so excited to have Dr. Zachariah with us. Dr. Zachariah, thank you for joining us this morning.
Well, Pastor, I'm honored to be here, and thank you so much for inviting me to talk to you this morning.
Well, what we wanted to do, there's so much good information out there and so much bad information concerning COVID-19. And so what we wanted to do is particularly focus in on our region, South Florida. I hear a lot of people say, are we more like New York City or are we more like Des Moines, Iowa? And we want to know, how is COVID-19 currently affecting South Florida? So I just wanted to hone in and focus in on that area so far. So let's jump into a few questions. Maybe you can help our congregation and all those who are listening to this beyond our congregation living here in South Florida gain some perspective concerning COVID-19. With the numbers you're seeing right now as of today, how do our cases and our deaths compare to the rest of the nation?
Compared to New York, we are much, much, much better. One of the issues with New York was, of course, there were a lot of people from around the world, especially from China and Italy and Europe, they descended in New York. And because of the travel and with so many apartment buildings in New York, unfortunately, they have the highest incidence in the country. Florida is blessed in such a way that, it's a vast area of land. There is a concentration in South Florida, especially Southeast Florida, maybe Tampa, Jacksonville, and Orlando area. But the traveling is what really brought a lot of the coronas into these cities. But compared to New York, we are much, much better. In Florida, I think there are about 34 or 35,000 cases, and there are about 1,000 deaths. I think Fort Lauderdale is, I believe, about 170 deaths in Fort Lauderdale. Of course, a lot more in Miami. I think both Miami, of course, Miami, because of the number of people in Miami and the diversity of the population and the people coming from cruise lines and airplanes and people especially coming from the Northeast, is a higher incidence. But Fort Lauderdale, especially in hospitals, if you look at the number of cases in the hospital, it has been almost steady for the last, at least for the last couple of weeks. We have not seen an increase in the number of patients treated with COVID. See, one of the problems is that we do not know how many patients they really have been infected with this virus. One of the crucial things that we have to do immediately is to test as many people as possible. Some of the studies show especially in California, in the Bay Area, they found out that for every patient who was tested positive, 80 times the number of people had antibodies. And that means they had the infection and they developed antibodies. So once we have all the data in, hopefully in the next couple of months, or at least in the next 3 months, we'll find out there may be a very vast number of people who already had the infection, who probably had no symptoms or minimal symptoms. But the problem is, in the first 14 or 20 days from the time you get it, the person may have no symptoms or minimal symptoms, or they never thought they had coronavirus infection. They are spreading the disease to other innocent people if you don't take the precautions.
Interesting. Interesting. You mentioned hospitals and some of the rates that the hospitals are facing. What has been the greatest challenges for the hospitals locally right now?
The main challenges are, when it first came out, because of all the hype in the media and all the, they had all this comparing the US with China, comparing us with Italy or Spain. They came up with all these models that said that millions of people are going to die in the United States. As a result of that, all the hospitals, for good reasons, the hospitals stopped doing all elective surgery, and they dedicated their entire resources to having this mass number of people coming into the hospitals COVID. It did not happen. Like at Holy Cross, I think there were about 25 patients with COVID. That number has remained the same. So for the most of the patients today, they are scared to go to a hospital. For example, we used to see between 8 to 10 patients a week with a heart attack. We don't see them anymore. We hardly see any one of them for many reasons. First of all, they're not doing anything. They're not going to restaurants. They are not moving around. As a result of that, even today, if a patient has high blood pressure or some other symptom, they would much rather stay home and or talk to the doctor on the phone and have a teleconference, but they do not want to come to the hospital. For example, there are some patients who need elective orthopedic surgery, but they are going to prolong this for a long period of time till they feel secure that they come to the hospital and don't get infected with coronavirus from another patient. So I think a lot of this, so the hospitals are suffering because patients don't want to come. Patients don't want to come to the hospital for any procedure. So I think those fears can be alleviated when we do massive testing to find out there are, maybe out of the 19 million people in Florida, there may be 10 million people. I just don't know. Nobody knows the number. If you know a vast majority of the patients already had antibodies, then you'll feel more secure that, that it's not going to kill everybody. And the fact that so far as you take personal protection, the chances of you getting it are low, much lower.
Okay. Now let's talk about COVID-19 itself. There's a lot of news out there in the media as far as cures and this is how to cure COVID-19, and we found the solution and we found the cure. What can you give us some clarity on what we're hearing and how to navigate to determine what's accurate and what's not accurate concerning a cure?
See, first of all, as of today, there is not a single cure that has been. There's not a single cure for COVID. There's not a single one. There has been many studies done on various drugs. In fact, the drug that was promoted by Gilead is an antiviral drug, and of course, drugs of chloroquine and also Z-Pak, which is erythromycin. They are doing a study right now. It's called Sovereign Study by the World Health Organization, having about 70 or 80 countries cooperating in the study to find out what is the best drug that is available to treat the disease. The problem is there are so many articles written, and there are so many people that write up all these articles saying that this drug worked, that drug worked, this worked, you have to do this, you got to take vitamins at home, and if you take vitamin D, and if you take vitamin C and zinc, you will never get the disease. It's just not true. It is just not true. So as of today, there is not a single drug that will cure the COVID virus. One thing we have to realize, when the COVID virus enters your system, depending on whether you got a little bit of it or a massive dosage, if you got a little bit of it, majority of the people they can withstand it. Most of the people get immunity. And They may have zero symptoms or mild symptoms, it goes away. But if you are immunocompromised, if you have some significant issues with your immune system, or you're an older person, or you have obesity, you have diabetes, you have cardiovascular disease, or if you have kidney failure or liver failure, if you have those comorbidities, then, and if you get a high dose of this virus, then chances are you're going to get sick. But right now, if all the data that show that if you can find the disease quickly and treat quickly, and it doesn't matter whether they treat them with chloroquine and Z-Pak or one of the other antiviral drugs. If you get them early and treat them early, most of the patients do better. The problem is once they become very short of breath, they have to go to ICU. There is something called cytokine storm. That means the virus gets into your lungs and gets into the cells, and then your defense mechanism it produces something called cytokine. That is the one that finally kills you. It is the virus gets into your system, and a secondary system that develops as a result of the virus is an antibody. It's an immune system trying to kill the viruses, kills a person. So, so once they go into the ICU and put a tube down your throat, the chance of recovering are about, depending on what data you're looking at, between 40 to 60%. So the key thing to do is to treat them early on. Now, the problem today is that there are so many stuff in the internet. There are people who especially they are at home now, they have nothing else to do. They get on the internet, they're going to go on Facebook, they're going to Instagram, they study, and there are thousands and thousands of postings. Most of them are wrong. People try to promote their personal agenda. Uh, so, unfortunately, there is so much of misinformation about the disease and how to treat them.
So where should people be going to get accurate information regarding COVID-19 and a possible? So when they see on social media, we found a cure, where should they go to verify that?
The best place to go is to if you go into Google NIH, National Institute of Health, they have the current and the most accurate information. They look at pure science. They don't look at any fiction or any emotion. They look at science, and they will tell you what works and what doesn't work. But unfortunately, most of us, people who have a lot of spare time at home now on a computer, there's a lot of spare time on the computer, they read everything and they try to believe everything. It's so funny that when the Lysol thing came out, I had a couple of patients wrote to me and say, is it FDA approved? They were so naive. They're nice, good people. They're good people. They had a good heart, but they thought it may be real. Wow. And so, unfortunately, there is so many misinformation. And
Google National Institute of Health.
The National Institute of Health. You can go to the CDC website, or whether you can the CDC website, the National Institute website. Those are the two best websites that you can go to and get the correct information. Because they give you what science. They give you science and not about any fiction.
Yeah. Because I think, unfortunately, we have people on both ends of the spectrum. You have the people that are overly panicking about it and have the false information. And then you have the conspiracy theorists out there that think everybody's making this up. So you want us to look at science and medicine for the truth.
And also the media, unfortunately, I'm not into politics, but the media, unfortunately, makes some of them make it a lot worse than it should be. And they have reasons why they do those things. Sure. But unfortunately, the patients get bombarded with all this nonsensical information that they start believing it. If you get the same information again and again and again, maybe not true, but people start believing this nonsensical information.
Okay, so let's talk about some of those questions that are out there that people really don't know concerning COVID-19. Concerning food, can the virus spread through food, even picking up food at Publix or restaurant takeout? That's a legitimate concern out there right now.
There is no data. There's no scientific data that if you go to Publix and picks up a fruit or something else, you take it home, there's a virus and a virus on top of that. There's no data whatsoever. But people make up all the stories. You know, they would say there was a employee at Whole Foods or an employee at another center had it, so he or she is transmitting it. It's an over exaggeration. If you know, I know a lot of my friends, when they bring the fruits, they wash them with soap and all that stuff. You know, if that makes them happy, let them do it. Do I do it? No, I don't. I just do not. I think the incidence of transmission in those avenues are minimal at best. The most important thing that when you go shopping at Whole Foods or Publix or Winn-Dixie or Walmart, make sure you wear a mask. If you can get an N95, it's a lot better. If you can't get an N95, make your own, you know, make it 2 or 3 layers of it. I think that'll prevent most of this transmission, because most of the virus is transmitted through air. Now, either people coughing, people sneezing, or inside a building because of air conditioning. So that's the most important thing. You got to wash your hands. Don't take me wrong. So if you go to Publix or one of the shopping places, when you come home, just wash your hand.
Mhm.
But I wouldn't go overly concerned about washing the meat 30 times to get the virus out. I think it's a little overkill.
Got it. Got it. That's helpful. How about another question out there? How about the theory that warmer weather will help stop this outbreak? Is there any validity to that?
Yes, the data shows that heat and ultraviolet light from the sun will kill the virus in minutes. No question about it. There is no question that during summer months, the spread of any virus, whether it's a DNA virus like influenza or an RNA virus like COVID, there's no question it kills them. But the problem is, if you, in the heart of summer, if you're inside a restaurant or a bar with 100 people, it doesn't work, because it's an air-conditioned place. An air-conditioned place is a crowded place. People are sneezing, or people are coughing, or people are talking. So in a controlled environment, in an air-conditioned place, whether it is summer or winter, doesn't make a difference. The effect is the same. But outside, it makes a big difference. For example, on a beach, if you go on a beach, the chances are much less. Or when you're going walking, if you're walking or on a park, or you're walking around on the street, I think in the summertime, there's no question the spread is significantly reduced. No question about that. But inside the home, or inside a bowling alley with 500 people, or inside a restaurant with 100 people, or a bar, it doesn't apply, because you are in a controlled environment, air conditioned environment. The virus spread because in cooler weather.
Interesting.
Inside the building, it doesn't make a difference.
Now, let's talk about children for a second. I see a lot of adults out there in Publix or driving around with masks on. I see a lot of children not wearing masks. Should children be wearing masks as well?
If you look at the data, they show that children below the age of 1 has a higher incidence of complications with the COVID. From 1 till high school age, they have or even college age, they have a much less incidence of complications of COVID. I believe that even children should wear a mask, because they may get it and they may have 0 symptoms, because they have good immunity. They have 0 symptoms. They do fine. You don't even know they had it. But the problem is they're going to play with the grandfather or the grandmother or someone older, and they may get it from them. So I believe that whether children, all of us should wear a mask, because we can spread the COVID to innocent bystanders who are a lot older than you. So I believe they should wear it.
Yeah, interesting. All right, let's switch gears, and now let's talk about the future. Let's talk about, as you know, May 1st is coming, the end of this week. Everybody, the whole nation's talking about this reopening plan and all of the phases and even beyond. Let's just talk about phase one reopening plan for South Florida in May. And I know we haven't heard an official word from the governor yet and from city officials, but from a medical perspective, what do you anticipate South Florida? What does our reopening plan look like, specifically in the state in the month of May, and specifically in our region here in South Florida? What do you anticipate that looking like?
I think Governor DeSantis is a very thoughtful and a reasonable plan. What he has done is he has gotten several, probably over 100 men and women from different business interests, give an opinion to him. I think they are meeting right now as we speak. In the next couple of days, they're going to make a recommendation to the governor. It's a double-edged sword, because if you have to open up the economy, otherwise we're going to have some serious issues in this country. At the same time, we do not want to spread this COVID to innocent victims. One of the key things that we have to do is to do the testing, both to see if they have, whether they have the disease, or do the blood testing. In fact, all the hospitals are now, hopefully by the end of this week, most of the hospitals will have all the healthcare providers do the blood test to see the IgG and IgM. If you have an IgM, that means you have the infection. But if you have an IgG, that means that you have developed antibodies and you're safe to go back to work. So I think that that is information that we lack right now. But I think in a thoughtful manner, they have to open up. For example, the beaches, they open up in Jacksonville. They open it for a short period of time. Every day. I think 4 hours in the morning, 4 hours in the afternoon. I think they have to do it in a very thoughtful and reasonable manner. I think the governor is working at that with input from a vast majority of diverse interest groups, and hopefully, the governor makes a decision. Then he is going to ask the individual counties or municipalities to make the ultimate decision. Whether they should open up the bowling alleys or restaurants. And even if they open up the restaurants, I would imagine they would require the CDC guidelines where people sit 6 feet apart. But if you go as a couple, of course, you can sit at the same table, but someone else has to sit 6 feet away from you. And when you are entering the restaurants and leaving the restaurants, you should wear the mask. But of course, you cannot eat with the mask on. But before and after, you should take all the precautions. So my gut feeling is that I know all the hospitals want to start doing this elective surgery as soon as possible, and they are getting geared up to do it in either this coming Monday or the Monday after. But the hospitals is a tough issue, because a lot of the patients, as I mentioned to you before, feel uncomfortable coming to a hospital. So hospitals are going to take a little bit of time. But as far as the other institutions are concerned, whether it is restaurants or bowling alleys or places of worship, so far as they've used the guidelines, and so far they are careful, I think they should be able to start hopefully in the next week or two. Again, the governor and the local leaders will ultimately make the decision. And a lot of people are very upset. Some people love staying home because they're getting paid. Especially if you work for the state or the federal government, you're getting paid. You'd much rather stay home. You get much less stress, unless you're stressed at home. They like the paycheck coming in. But a lot of the people who make a living, their livelihood comes from working, and especially someone working in a restaurant as a waiter, or a lot of other jobs, working in a hotel. They want to make some income, and so they want to go back. I think the most important thing is to do it in a reasonable manner, thoughtful manner, and don't jump into this, but do it gradually, and see what others have done around the world and learn from them.
Now, that's so helpful. Now, okay, so you talked about restaurants and small gatherings and using the CDC guidelines. How about, because I know this is on a lot of pastors' minds and church members' minds, how about the large gatherings like a church worship service? any idea when you think that would be permitted by? I know the governor's been very clear as far as not stopping large gatherings, but when do you think it would be a safe time for those large gatherings to
You see,
start?
so far as they can keep the distance, between individuals. For example, I told you the most important thing is to do the testing. If the testing comes back, as majority of the people have immunity, have antibodies, then they can sit next to each other. It's no problem because they are not going to transmit to anybody else. For example, if 50% of the church members at Call Ridge are have antibodies, they can sit in one room. 1,000 of those men and women can stay in one room and nothing is going to happen because they're not going to spread it to somebody else. The problem is what happens someone who does not have antibodies is the problem. So till we have the testing on all individuals, which is going to take a while, to test 350 million people in America is going to take a while. But if you do the IgG, and the other problem is some people refuse to do the testing. Like, as you well know, some people refuse to they take the vaccination. And if we can have a massive testing, we can have a much better idea. So right now, any reasonable person who makes a recommendation to go back to church would say, look, you can have the service, but you got to follow the CDC guidelines till we know if 90% of the people in Broward County have antibodies, then you have much less to worry about. But you still worry about the 10% who doesn't have it. And so until we have a standard therapy, if we can find that some drug does work and cures, gets rid of this virus, or we find vaccine. But the problem about vaccine, you're talking about at least a year from now. So vaccine is going to take a long while. But the cure part of it, maybe in the next few months, God willing, they may come up with some combination of drugs that are going to fix the problem. Then people feel comfortable. Hey, look, even if I get it early symptom, I take the drug, it'll fix the problem. So right now, I know I'm giving a long-winded answer, but I think right now, I think they should have church services so far as they keep the distance of CDC guidelines of everybody staying 6 feet away.
Okay. Final question, and you kind of alluded to it. I mean, this could take a year. We could be a year away from a vaccine. So I think one of the questions on everybody's mind is this going to be an annual occurrence? I mean, we're kind of treating this season right now like this is once in a lifetime, but could we see something like this next spring?
The question is about if you look at the RNA viruses, which is SARS and MERS, they have not recovered. They have not recurred after that. Both those, they're the same group of viruses. They're all coronaviruses, the same group of viruses. They have not recurred after that. Now, right now that all the RNA viruses, if you develop antibodies, the chances are you won't get it, with one exception. If the virus will mutate, the RNA viruses mutate much slowly than a DNA virus like influenza. Influenza can mutate every so many months. The RNA coronaviruses takes a long time to mutate. So statistically speaking, it may not occur, but the only time will tell, because if they completely change the mutation, comes up with a new, with a totally mutated virus, the chances are yes. But it's too early to tell. It's a novel virus. We don't know much about it. And hopefully it won't happen. Hopefully we should be able to get rid of this virus like we got rid of the SARS and we got rid of the MERS. And hopefully that'll happen and we won't get it, but only time will tell.
Okay. Dr. Zachariah, you've been so helpful. You need to be on all the media outlets because you bring such a great perspective and such a calming but truthful approach and perspective to COVID-19. We're grateful and thankful for all of our healthcare workers, including